Good afternoon or good morning, everyone, depending on where you are joining us from. I'd like to welcome you to the NOAA Environment and Climate Change Canada Extreme Temperature webinar series. This is part of an ongoing collaboration between NOAA National Weather Service and Environment and Climate Change Canada. I am Kim McMahon. I am the National Weather Service Public Weather Services Program Manager, and extreme temperatures happens to be just some of the hazards that I oversee. I will be facilitating today, and I am joined by my colleagues from Environment and Climate Change Canada. I will hand it over to you, Melissa.
Thank you, Kim. I'm Melissa McDonald. I'm with Environment and Climate Change Canada's Meteorological Service of Canada's Health and Air Quality Forecast Services Program. We co-host these wonderful webinars with Kim and our colleagues at NOAA, and we look really forward to seeing the presentation today. And I'm joined as well by my colleague in heat, in particular, Brittany Murphy, to help moderate the questions. Brittany, sorry, please introduce yourself.
All right, yeah, so my name is Brittany Murphy. I work on our National Health and Air Quality Forecast Services team with Melissa McDonald, and I'm a program support officer, as Melissa said, primarily helping with heat, but also with cold and air quality.
Thank you, Brittany, and thank you, Melissa. So a couple of logistics before we get started. This presentation is being recorded, and by attending this webinar, you consent to the recording. So as we continue, please ensure your microphones are muted unless you're speaking. And we will have time at the end of the talk for a question and answer period. In order to get your questions brought to our attention, you can either use the raise hand function or type your question in the questions box. I will state that typing your question in the questions box will also help us keep track of any questions that we may not get to at the end. So I'm now very excited to introduce our talk and our speaker. Today, we have a guest speaker that will address the challenges and opportunities in using heat mortality and emergency department information for estimating health burden. Our speaker today is from the Centers for Disease Control and Prevention. It's Dr. Rish Vidya Nathan. And Dr. Vidya Nathan is a senior health scientist with the Climate and Health Program at the National Center for Environmental Health in the CDC. Rish's training and work experience cover a wide range of substantive areas, including epidemiology, exposure assessment, and data science. In addition, he has several years of experience planning, coordinating, and implementing strategies to facilitate the conduct of environmental health surveillance and translational research projects. Specifically, he has been able to establish mutually beneficial collaborations with various academic institutions, state and local health departments, and federal agencies on efforts to identify and characterize populations most at risk to extreme heat and other climate-sensitive exposures. I will stop sharing my screen and go ahead and take it away, Rish.
Thank you. Can you guys hear me okay?
Yes, loud and clear.
Perfect. Let me share my screen. Okay. Can you all see my screen?
Yes.
Okay. Thank you. Thank you, Kim, Melissa, and Brittany. It's my pleasure to present on this call.
Rish, we may have lost your audio.
Yeah, can you hear me now?
Yeah, yes, we can.
Yeah, I'm just trying to. Yeah, I'm trying to advance my slide. 1 second.
Yeah, if you are, oh, yep,
okay.
We can see it's on the presentation outline.
Okay, perfect. Yeah, so for my presentation today, I plan to cover these topics. I will start with an introduction followed by some considerations one might think about before carrying out a heat health analysis. Basically, I'll highlight some of the challenges and opportunities involved in using health data for measuring impacts arising from weather-related exposures such as heat. Then I will highlight a few projects that use health data to quantify impacts resulting from heat. And lastly, I will highlight some applications that have integrated some of these heat health impact information. So that's it, my introduction. I guess for this group, I'm thinking like I don't need to like dwell on the introduction part. Like everybody knows how bad extreme heat is, and especially if you're looking at what happened this summer. You can see several days of extreme heat in multiple regions. And as NOAA put out earlier this year, like we're experiencing one of the hottest summers in recent years. And the monthly outlook, this was from earlier this summer, like sure enough, like the impact on public health was devastating. Like the predictions were accurate. And consequently, our news cycle has been dominated by articles on extreme heat. Some of these news articles highlighted like how heat exposure is affecting sensitive populations, including older adults, people with pre-existing conditions, economically challenged communities, and also outdoor workers. And we also noticed some scenarios where heat and wildfire smoke were impacting communities as well. And quite widely, several news articles from reliable media sources, made the connection between climate change and, extreme heat or extreme weather events. Yeah, and this is a graphic on the left. The graphic on the left is from Climate Central, and it describes the number of anomalous temperature days and observed this summer. And this is based on the Climate Central's climate shift index. You can see several regions like such as the south, southeast, and the southwest had exceptionally hot summers, like with so many high temperature days. And as you all know, climate change is going to make this worse in the coming years. And the fourth National Climate Assessment, which was released a few years ago, confirmed this. And the forthcoming fifth National Climate Assessment will reiterate this even more. And in terms of what we do at CDC, especially given our interest in climate sensitive exposures and how to sort of build the evidence base and be able to help assist our state and local partners, and also to sort of build a narrative around some of these extreme weather impacts. We focus on several different aspects of heat health epidemiology. For instance, we look at knowledge sharing and technical guidance where we conduct some surveillance related research and try to like sort of provide information back to our stakeholders. And we've been doing this for over 10 years. The program has been around for more than 10 years. And also, one of the primary drivers for us when conducting public health surveillance or epidemiological project is to build this evidence base that I talked about, but then also help inform several downstream climate adaptation effort, as well as like sort of share this health evidence with our partners. For example, like sharing information on heat health impacts with National Weather Service, or providing some methodological insights into a partner's work. So all these activities are something that we do at CDC. And I'm going to start talking about some of the considerations before planning heat health analyses. Again, these are just what I thought would be important. There are several more considerations, and there are aspects of heat health epidemiology that's quite vast, and perhaps not everything can be encapsulated in like a 40-minute discussion, but I'll try to highlight some of the most important considerations, and then I'll be happy to answer other questions you might have. If I have missed out anything, please let me know. Here are some of the health data sources that we typically have when it comes to assessing the impacts from heat, or for that matter, any weather-related exposure. So, a majority of these data sources that you see on the slide, are available to CDC, either through various partnerships we've established with the state and local health departments, or through some mechanism where we have a data use agreement with the actual data providers. So for example, the mortality data, which is coming from our National Center for Health Statistics, is maintained in a system called the National Vital Statistics System. So many of you may have used the CDC Wonder, which is a database which provides information on mortality data. So CDC Wonder information is based on this National Vital Statistics System. And then we also have state and local healthcare administrative data sets, which are really helpful in teasing out relationship between extreme weather and related health outcomes. And then more recently, we have these private vendor data sets. So based on electronic health records, health insurance claims data. And lastly, we also use near real-time health information and syndromic surveillance, which is using a combination of discharge diagnosis codes and chief complaint information. So again, this is available in a timely manner, so potentially useful to enumerate health burden on a near real-time basis. And again, this I will not go too much into the meteorological data sources, as many of you know, like what's available in terms of weather station data and all the different considerations one might need to look for when using weather station data. But again, if it also depends on the primary daily health metric that we're interested in. So if we're relying on daily maximum temperature or daily minimum temperature for our analyses, I guess we can pretty much use weather station information. But then if we want to sort of bring in humidity and compute apparent temperature or heat index, then we may have to sort of look for complete stations with that information, which reduces that set. But then we also can use model-based data. So many health studies, have used model-based information for heat health analyses. And I guess one thing to note is, even though these model-based data sets are at some grid resolution, there is a lot of effort, and again, CDC helps with the processing of this data as well. So we try to convert this to census tracts or county level to match the resolution of health data. And then in terms of data for areas outside the contiguous US, it's always challenging for us to get complete data set for areas like Alaska, Hawaii, and other US territories. So we typically do not have the same resolution for health data. And then also when it comes to matching the health data with meteorological data sets, we do have limited options. And then the model-based data sets are maybe run at different resolution, or we haven't explored the use of model data for the autonomous domain. And briefly talking about the analytical approaches that we can typically use to look at heat health information. The first one, many of you know, is either ICD-9 or ICD-10 code-based approaches. Basically, you look for a particular heat-related code, and once you have heat-related code, you just try to extract that from all the records that you have in the database. And in terms of how those codes are actually coded, it depends. For instance, if you're using, so let's say administrative, healthcare claims data set, it's basically used for billing purposes. So that code is something that one might see when the medical transcribers take what's as entered as a chief complaint and convert that to let's say some structured information using these codes, mostly for billing purposes. And then when it comes to mortality, these codes are pretty much like what's available on the death certificate. So again, as you can see, it can be based on expert judgment. So sometimes these information can be biased, and then also it may not truly capture the entire gamut of conditions that are impacted by heat. So definitely when using code-based approaches, like, we should be mindful of potential underreporting. And then there are statistical attribution approaches. The basic mechanism is, statistically, we try to like relate heat with an adverse health outcome. We generate a risk profile, or we generate, a graphic that tells us at various temperatures what's the, risk, or how does the risk change with different temperatures. And based on that, we try to like, look for, points where like the burden, changes, or inflection points, and then try to like estimate health burden. Again, this gives people the option of controlling for other environmental confounders, and also helps us to sort of look at a broad swath of conditions that are impacted by heat. Again, I will discuss this in later slides about what this exposure response profile means and how it can be used for excess burden estimation. And then the other important aspect of conducting a health analysis or heat health analysis is like, once we decide on the data sources and the methods, I mean, an important consideration obviously is the scale at which you want to conduct this analysis. Again, working with meteorologists, like, public health researchers, we've understood the nuances of weather data. And I personally can say that, I've had many, important enlightening moments, let me say that. And for instance, like selecting the finest scale possible for conducting analysis is preferred, as it avoids exposure misclassification. Unfortunately, health data may not be available at that resolution. So, if you're creating a population level heat exposure metric, it is desirable, prior to linking with the health data, just understand which, if you have multiple weather stations in a county, just pick the weather station that might most represent that county. It's always hard, but those things, maybe working with a meteorologist or working with someone who's familiar with the data can always be helpful. And also in terms of the temporal resolution of the data set, most health data sets are not available at a sub-daily scale. So we don't have, routinely have information on what's the time of the day somebody got admitted to the ER. Like, maybe that's available somewhere, but it's, some of these aggregated data sets that we have access to, we do not have that information. And then in general, a high resolution data set, both in terms of geography and time, the access is limited. And it does require us to work with, various partners to, either through a data use agreement, like I mentioned earlier on the health data consideration, it requires us to justify why, we need this data. And then often that justification comes from the fact that we're conducting this analysis at a particular resolution. The next consideration, like, which is the best measure of heat exposure, daily heat exposure, this is a challenge we often face in conducting heat health analyses, selecting a daily heat metric and defining, for instance, a heat wave for public health purposes are a bit more challenging than it sounds. Like, obviously, one approach is to sort of, use all these different methods or all these different heat metric, and then pick the one that has the best predictive power. That's definitely an approach. Or some of the decisions we make on using a particular heat metric could be based on the availability of data, how sufficiently long that time series is. And also it could also be, maybe if you're exploring a certain aspect to your analysis, for instance, like, what's the impact of daily minimum temperature? So things of that nature will dictate why you want to use these different, daily heat metric information. But, by and large, it would, we should, I guess, like, at least when we conduct national level analyses, we pick a heat metric that works reasonably well for most regions. So that's kind of like the approach we take. It's very hard to sort of identify one that works for every single region, but by and large, what works for a majority of regions is basically, the heat metric that we go with. And then the other consideration, this is the epidemiologists will understand this, is sort of looking at what is the delayed effects of heat exposure. As you all know, impacts from a single extremely hot day can last for several days. We typically, parameterize statistical models to identify the appropriate number of lag days. Like, for example, we look at these relationships either at the county level or the region level, whatever level we are trying to like predict impacts, and then try to see, how does that pattern vary? Like, so for example, the image on the left, you have the relative risk on the y-axis and the lag period on the x-axis. So basically, this is a lag response curve. So you can see the risk is most pronounced on the first day of exposure, that is same day, and then it persists for the next day, but then it tapers off and the risks become statistically, not statistically significant. And I've kind of like provided the definition of what's statistically significant, what is statistically non-significant. But on the image on the right, it's the same pattern for the first, the same day and the following day, but then the risk dips, but then comes back up, after a few more days. So all these considerations, can impact your analysis, especially if the goal is to, estimate the health burden. These decisions will impact like the number of lag days will impact your final analysis. Again, I'm going to like present to you like a couple of analytical projects. Again, these are pre-decisional, we're still working on publishing this information. So yeah, please. So this is like still in its draft form. So yeah, and I guess like, this is describing the summer of 2023 from a public health standpoint. So like, for example, we know that the summer months, May through September 2023, featured like record-breaking heat waves with many parts of the US experiencing persistent impacts from extreme heat. And we know like the adverse health impacts, including deaths and illnesses, attributable to high temperatures, garnered considerable attention this summer. Again, for instance, between June and August, CDC's Climate and Health Program received several media requests to discuss public health impacts resulting from heat. And in terms of how bad things got, CDC issued like public health, alerts on a couple of days this summer upon noticing high levels of, heat-related ED visits. So again, this is, those ED visits that I mentioned were based on syndromic surveillance information. Again, like many of you may have, heard about CDC's National Syndromic Surveillance Program, which collects information on emergency department visits. And then, they collect on several conditions, and they also collect information on heat-related illness. And this information is available to us on a near real-time basis. So for example, like, they have several facilities reporting, information, with a day's lag. So within 24 hours of patient visit, like that data, can be available in the NSSP system. And then in terms of coverage, like the map on the right shows you what the coverage is. But about 78% of US ED visits are sent to NSSP like within 24 hours. And then it takes another 2 weeks for the data to sort of fill in from these, reporting facilities. And in terms of the analysis that I just want to like highlight, this is a descriptive analysis. So we were looking at trends in, heat-related illness emergency department visits. And, our goal was to like sort of provide a descriptive analysis and then trying to understand the severity of 2023 heat season. And then also make region-specific comparisons to look at like how 2023 was different from previous years. So we also explored differences in these HRI rate patterns, by covariates such as age group and sex. And if one slide, if I have to say how bad the heat season was, you can see like for most regions, the the heat-related illness rate observed this summer was exceptionally high. The red is 2023, the blue, the light blue, or the shade of blue is previous years, average from previous years. So you can see certain regions like regions 4, and then I've given the map on the right tells you which states those regions correspond to. So you can see between the first 9 months, like there were around like 61,000 HRI-ED visits recorded in the NSSB's Essence system, and 94% of these visits occurred during the summer months of May through September. And if you look at the time series, pattern, like, so the red line is basically denotes the daily HRI. One can see like certain regions experience persistent impacts from heat. So you could continually see peaks in that region's time series pattern. And like, for example, like regions 4, region 6, region 7, and region 9 had multiple peaks, or the peak persisted for a really long time. And then on this graph, you also see a blue line, which is sort of what's the expected based on an average computed from previous years. So again, for some of these regions, you could see exceptionally high rate patterns compared to previous year's average. And if you look at how high those peaks were, like we looked at the 95th percentile daily rate, like from previous years, like say computed based on data from 2018 through 2022, we noticed that several of these peaks were like way higher, like, like the number of days you saw how these daily HRI exceeded the 95th percentile, you can see that there were several days. And what's also important is some of these days were consecutive in nature. For example, like, region 6 and region 9 had 21 and 18 consecutive days above the 95th percentile HRI rate. And again, also of interest is, region 6 and 7 had days with highest ever recorded HRI rate. So that's like in the last 6 years of data that we have from the NSSB's Essence system, we noticed rates that were pretty much the highest. So it was pretty severe summer, as you can see from these health impact information. And then also this summary, this heat map captures how each, so this is by month for each region, it is by month and year. This heat map captures, how many number of days each region had that was about the 95th percentile rate. So if I know like the numbers may be hard to read, but if you could look at the colors, like, so the shades of dark blue, you will see most regions have a darker shade of blue for 2023, and most summer months had substantially higher number of days above the 95th percentile. And in terms of looking at these differences by HRI rate by these age and sex covariates, we do see that males and persons aged anywhere between 18 and 64 were most affected in 2023, and these populations accounted for a higher HRI rate. But then we did not see a difference between 2023 and previous years, suggesting that these differences primarily were just because like the number of HRI visits that we saw this year above and beyond like what was seen in previous years was typically driven by exposure patterns rather than any specific change. Any specific aspects of these age and sex related covariates coming into the picture. So so here are the key takeaways from this analysis, or this descriptive analysis. So yeah, we know like in recent years we're seeing extreme heat emergencies becoming more ubiquitous across the US. Like specifically this summer signified how persistent and worsening extreme heat exposure can be. Again, like something that we can expect with climate change. And then our finding of increased risk of heat-related illness for certain demographic groups, is similar to other analyses, like, maybe, the 18 to 64 could track with the working age population being impacted. Maybe, people, having some occupational related heat-related illness as well. And then also, we saw like regional differences in HRI risk and HRI rate. This, could sort of like indicate like, in addition to exposure patterns that we saw, acclimatization, behavioral responses, and, other heat adaptation strategies could play a vital role in determining health impacts. So for instance, even in regions of the United States with high air conditioning prevalence, such as South and the Southeastern United States, we did see an increased rate of heat-related illness, like meaning maybe like there are populations in those regions who are impacted by extreme heat may have limited access to cooling spaces. Again, like there are several factors that determine AC use and access to cooling spaces, which include higher energy costs, maybe like people don't use AC because of energy costs, or other reasons that might be important to consider, like in terms of how they access a cooling center. And I guess like I would say, like sort of like the one caveat with this analysis is this is all based on code-based approaches, right? This is all based on chief complaint information and discharge diagnosis code. So potentially like this could be an underestimation. The impacts could be far more pronounced if we take into consideration a more broader outcome. And I guess like in another limitation, like, the regional data that we have from the NSSB's Essence system is great. But, if we want to look at, information that's occurring at a sub-regional scale, like so looking at local exposure patterns and how that sort of is leading people, or how that's impacting local populations and impacting any urban heat island effect, regional data might not be sufficient. You may want to use a sufficiently high resolution data set, such as like county or even finer. So in terms of, that's the next analysis is how do we sort of estimate the number of deaths associated with heat exposure, and also conduct this analysis at a finer resolution so that our numbers can sort of rely on some of the assumptions and predictions that change locally. So I guess like most of you are familiar with the NOAA storm events database, so and I just grabbed this information. So I guess this is all mostly media based and reported by NOAA's regional offices, and we sort of look at in terms of weather related impacts, we're looking at around like 153 deaths each year. So that's sort of based on information reported for 2013 through 2022. And then if you look at what's reported in death certificates, we know like, again, like this is again code-based information. So we have about 848 deaths, and this number varies. Like, so that 848 number is an average based on 2005 through 2019 data. And more recently, if you look at the last few years for which we have data available, 2019 through 2021, that average is slightly higher. But then we need to like consider that the true mortality burden is higher because heat exposure is a contributing factor to deaths resulting from many causes. So that's always something that we should know going in. And here is a map of the rate for both the deaths reported in the storm events database and the death certificate. Again, this is just to look at and I've used the same scale here. So one can see that we're looking at slightly lesser number of deaths from the NOAA storm events database, and it seems to be consistently lower than what's reported based on death certificate. I mean, and in general, higher rates are observed for warmer regions. However, there are certain exceptions. Then the next thing is this map shows what was the actual heat index, the median heat index on days with heat-related deaths. So I used the day off and as well as like a 1-day lag just to look at what the temperatures were for each death, and then I summarized that information by state. So when you look at that, when you look at the map, both sort of have a similar pattern for the south and the southeastern region, but then slightly different when you go to some of the colder areas, colder states of the Midwest and the northeastern regions. Again, based on the NOAA storm events database, there are states with no heat-related deaths. And then the next question is, how do these deaths compare against like a heat attributable excess deaths that we get using a statistical attribution approach? So as you can see, this is not a new thing. Like people have done this, successfully, and there's like several publications available that suggest, how to sort of estimate heat attributable burden using a statistical approach, as well as some studies have quantified, what the burden is for the US as well. So one thing is most of these studies are multi-country studies, and the number of locations that they've used in the US, are quite limited. Like it doesn't use, all counties or like a fairly complete list of counties in the US. Again, that is not to say that these studies are not useful, but some of the modeling decisions they've made, account for, variations in heat mortality relationship, sometimes observed across countries or for a limited set of counties with data. So again, these are still, giving us the information in terms of how to sort of approach this problem in terms of providing methods, and also, some of the decisions that I talked about. These basically like highlight some of the opportunities of conducting an analysis as well. So another thing, this is again, I mentioned this earlier about this heat mortality relationship. So all these studies use something like a two-stage analysis, or something where the ultimate goal was to generate a heat mortality relationship or an exposure response profile. Different studies call it differently, but basically this is how I would describe the heat mortality relationship. So you have that black line, increasing black line, that's the mean risk, and then it's a function of temperature. And most heat mortality relationship, show some form of nonlinearity or nonlinearity about a certain temperature percentile. So the yellow dot is pretty much, where the effect of heat starts to show up. So basically you can imagine that yellow dot as the point at which the effect of cold stops, and then the effect of heat starts to show or impact mortality outcomes. And then as you go higher, basically you're looking at different percentiles at which the risk profile changes. And again, like the presence or absence of risk is determined by that yellow dot, and then how severe that risk is based on is understood based on the temperature at which you look at each of those risk values. Again, the gray band is the uncertainty around that mean risk estimate. So if you sort of take that heat mortality relationship, so the next thing is you could look at starting from that point where you center this heat curve, like the heat mortality relationship. You could look at the total heat attributable burden, or if you're interested in maybe looking at what the extreme heat exposure is causing, let's say extreme heat defined as the 95th percentile, or you could look at any specific temperature range that you're interested in. So all that is possible with this exposure response profile. And another aspect here is, but we need to keep in mind just these exposure response profile of the heat mortality relationship alone is not going to be sufficient for us, because obviously the risks vary over a range of temperatures, and you might see a similar heat mortality relationship for both a warmer climate versus a cooler climate. That is, I mean, the shape where the risk starts might be different, but the shape might be a little different. But what's more important to consider here is the underlying heat exposure patterns at each of those temperature ranges. For example, if you're looking at a warmer climate, the temperature will start to climb up to a point and then will drop. But then in a colder, area, you might see like not so high temperatures like that. Those events might be very rare. So just an absolute value of about 100 degrees or 95 degrees may not sort of, give you sufficient sample size in terms of evaluating the impact of an extremely high temperature. So when you combine the two, that is the risk information with a typical heat exposure pattern, you get something called like the heat attributable deaths. This is the excess deaths. This is kind of like what most studies report, and most studies report this, specifically for a different region, or they summarize it for the entire US. But this is basically the concept. You just take a risk information, combine that with underlying heat exposure patterns, basically person days of specific temperature exposure. And then when you combine the two, you're getting heat attributable deaths. So keeping this in mind, we started an analysis where we looked at what's the impact of heat, like basically the excess burden in these for this 15-year period. And we used data we got from NOAA, National Weather Service, like the National Center for Environmental Information, as well as like using model-based reanalysis data for basically using heat index. Again, we use a two-stage analysis, very similar to what most most of these excess death or statistical attribution studies have used. And so the two stages involve like, first stage is like a county level time series analysis. So we're looking at May through September, and we're looking at like a heat exposure measure derived from daily apparent temperature or heat index, maximum temperature, mean and min temperature. And we're also controlling for things, and since we're using all-cause mortality for this analysis, we're controlling for anything that might sort of influence the risk estimate. So air pollution, seasonality, any long-term trends in mortality data, since we're looking at 15 years of data, holidays, day of the week, all that. And then, as I mentioned, we're exploring different lag patterns, starting with a 1-day lag or a 7-day lag, so anywhere between 1 to 7 days of delayed effects. And then the second stage is basically once we generate information at these county level, just to get better stability, we are trying to like meaningfully aggregate information across larger geographic scales. And these pooled analyses are conducted using standard meta-analyses or meta-regression techniques. So this is the risk profile for different heat metrics. So again, the x-axis here is not daily heat index, it is the percentiles of the distribution for the respective daily heat metrics. So as you can see, there is like a lot of correspondence between like various heat exposure heat exposure measures derived from various heat metrics. So the red is the daily maximum heat index, and then the darker shade of blue is the Tmax, but they overlap a good bit. So by and large, for most regions, daily maximum temperature or daily maximum heat index seems to offer the most robust heat mortality relationships. And by the way, and these regions are climate regions, and I've given you like what those regions mean on the right. That little map is a key for what those regions, what states each region comprises of. And then this is the lag response relationship. So as you can see, like I mentioned earlier, like most regions, the maximum effect is observed on the day of heat exposure followed by a day. And most areas it tapers into the non-significant zone, but it does come back. For some regions you do see, like as you go to maybe day 4, day 5, they sort of come back. But then I guess for this purpose like of estimating excess, since the most pronounced impacts are observed on day 0 and day 1, we just looked at a black 0 and for most of our analyses. And also another thing that when we do the first stage modeling is to sort of look at that minimum mortality daily maximum heat index point that I mentioned from the heat mortality relationship. As you can see, like this information kind of varies by county, and it can you can see a pattern sort of as you move from warmer to cooler areas, you tend to see a decrease in the minimum mortality heat index. And also, if you're looking at a county profile, like these are just examples of like what one might see in terms of a heat mortality relationship at the county level. So, for instance, this is showing you like as a function of daily maximum heat index, how the risk increases. So for Maricopa County, like you do see a risk increasing drastically as a function of daily maximum heat index in this case. And those risks are very significant. And in a place like New York, the risk is again increasing, but it's the increase is the slope is not that drastic. In a place like Fulton County, Georgia, you do see an increasing risk, but you do have a lot of uncertainty, and that uncertainty could be due to several other factors. But by and large, you do see non-significant risks. And in a place like the pattern that you see for El Paso, Texas, like you do see an increase, but then it tapers off after a certain temperature. So again, like this tells you, like if you're focusing on any specific temperature point or any percentile threshold about which you're looking at risk, this sort of gives you that indication as to whether that risk information will be significant or not. So if the risk is not significant, then the burden numbers will also not be significant by and large at the county level. And this is basically a map showing if you're computing all the heat-related deaths above the 95th percentile, and then look at that as a function of like how many total heat-related deaths you see, basically trying to get a percent of heat attributable deaths. So you can see for most counties, most regions, like you tend to see anywhere between 25 to 40% of deaths occurring above the 95th percentile. The remainder, like that is like depending on where you are, occurs at moderately hot heat index days, not necessarily above the 95th percentile. And also I should add that some of these hatched patterns that you see basically indicate that these are not statistically significant numbers because as I mentioned, for a variety of reasons, we may not have stability at the county level. So again, when we notice some of these statistically non-significant values, another approach is to sort of look at what the relationship looks like at a regional level. And this is the same exposure response profile that I showed for some of those counties, but at the regional scale. As you can see, given that information is pulled from multiple counties in that region, you tend to see a much stable risk estimate, a much stable risk profile. And for all regions, you do see heat-related risks increasing with heat index, and with some degree of nonlinearity for some regions. But then when you convert that risk information to like a burden measure, like so this is looking at what's the proportion of burden occurring at different temperature ranges in the US, and the non-significant ranges are grayed out for each of those regions. You could see there's a completely different pattern based on warmer versus cooler areas of the US. So cooler area, you tend to see a lot of impacts occurring at moderately hot conditions, not necessarily what would be considered hot. But then in warmer areas, you're seeing an increase up to a point, and then even at very high heat index ranges for those some of those south and southeast areas, you do see a drop. Like so, it's not a consistently increasing. But again, what this tells us is the burden occurs over a wide range of temperature, and then the burden can be very different depending on where you are in the country. And then the next thing is, this is again at the county level, what's the overall heat attributable death rate? So that is you calculate the excess rate, divide by the population, the county population. So this is an average across those 15 years of data. You can see the areas in Northeast, Northwest, Southwest, and West have really high, heat attributable death rate. Again, the shaded area suggests that, some of these information might not be statistically significant at the county level, given we're dealing with small sample sizes and other factors that influence the risk estimate. So again, now putting everything back, that is we have pretty much information from NOAA storm events database. We have information from what's reported on the death certificate. And then now we also have information on what you can get using a statistical attribution technique. So this suggests that, we do see, we can actually get this information from the NOAA storm events database, but we do see that certain regions have limited information on fatalities. So, and then when you compare this with the death certificate data, again, I'm comparing excess death rate. So you could see, as I mentioned earlier, the rate numbers are higher, excess death, or this is actual deaths, numbers are higher when you report based on death certificates. Again, Southwest, it's interesting to note, one county, Maricopa County, accounts for a significant burden for heat-related impacts. And then if you're just looking at a specific percentile threshold, let's say what's happening about the 95th percentile, that's just what's happening about the 95th percentile is giving you, just using the statistical attribution technique, you do see sufficiently high numbers just about that 95th percentile value. And when you compare that with what's reported on death certificates or what's available from the NOAA storm events database, you do see that that can be substantially high. And then only for Southwest, that number isn't high. But for all other regions, just the deaths, the excess deaths that you see about the 95th percentile for that region can be very significant. And when you put everything together, that is, you're looking at all heat-related deaths in conjunction with the other three things I mentioned. So you could see how the death rate could be substantially higher when you're looking at a statistical attribution technique versus any other information, right? Any other data source for comparing this information. So again, just this is, I would say this is sort of a summary of what the heat attributable burden is when you're looking at different data sets, data sources for computing this information. Again, these are per summer numbers, average based on this 15-year period. So, anywhere between 150, from NOAA storm events database, to 4,000. Again, I would say the 4,000 number is a bit conservative. I would say it can be even higher because depending on some of the modeling decisions I've made, this is a little conservative number, I would say. But again, it just gives you a sense of what the spread is. Depending on which data set you use, you could have different results. Again, key takeaways, very quickly, we know there is an association between heat exposure and all-cause mortality. So it's just, giving you that extra, reason to use a statistical attribution method when it comes to looking at, excess deaths. And again, certain regions may account for a high proportion of heat burden. And as I discussed, some of the study design, modeling assumptions, and all the other considerations I talked about could impact your final numbers, could impact how these heat mortality relationships shake out. And then, as there are different approaches to estimating heat attributable burden. Again, we're going to get different numbers based on different data set, but I guess what numbers we rely on depends on our research question. It's not I'm suggesting that we should all go with the statistical attribution approach. So the suggestion here is we should carefully craft our research question in terms of what's the excess or what we're really after when it comes to heat-related mortality, and then sort of look at the appropriate method. So I would say all approaches that we've used, can inform public health practice. So very quickly, some of the applications. So the essence information, the syndromic surveillance information is available on the heat health tracker, and we routinely provide this information, daily heat-related illness. And we will be, providing that information. On the next version, we will be having a lot more functionalities to like sort of look at the regional patterns in HRI. And also, we've been working with National Weather Service in terms of looking at how these heat health information can be incorporated into a prototype. So again, the heat risk prototype 1, which used just a local weather and long-term climatology. Now we're potentially, integrating these health impact information. So and calibrating these thresholds for these color codes based on some of the health evidence, can be very useful from a public health standpoint. And in terms of next steps, I will just read from the slide in the interest of time. But I think one important consideration is, we need to systematically assess and disseminate heat-related health impacts. And I guess looking at how the burden varies with a particular hot summer, or looking at specifically how a community is impacted because of extreme heat is very important, and just drives increases public's awareness. And more of this can actually make how when the climate is changing, how these numbers and data support an increasing trend in some of these weather related impacts could drive home the message that climate change is here, and it's going to be devastating for public health. I think that's all I have.
Thank you, Rish, for that amazing presentation. And I think you've done a great job in trying to cram so much information and so much of the work that you've done in less than an hour. So I really appreciate you sharing the work that you have done, sharing your results thus far, and providing just another look at why heat is so dangerous and how it can be so dangerous. I will point out from the NOAA perspective, our storm events database is underrepresenting all the heat deaths that occur, because it serves a specific purpose in noting that deaths that occur when significant heat or abnormal heat is occurring or present. And also you mentioned that it's not easy to get all the mortality information, especially on shorter time scales, which is required by at least the National Weather Service. So at this time, we have a few minutes, and I'd like to open it up to our moderators for the questions that we have in the question box. Please feel free to continue adding questions into the question box, and we'll get to as many as we can. So Melissa and Brittany, take it away.
All right. Thank you very much. It was a great presentation. Thank you very much, Rish. I know we did have a few hands up for questions, but we're hoping that everybody can put them into the question box, because we likely won't get through all of them. So if you do have your hand up and you can put your question in the question box, that would be best. So I'm going to start with the question boxes. So the very first question we have was, thank you for your informative summary. Will you be able to circulate your heat illness flag algorithm used to determine HRI in the EDs?
Yeah, we can. I mean, it's available. Are you talking about the definition that we have, the code set and the syndrome definition that we use for determining heat-related ED? Yeah, that information is available, and we're actually going to summarize that analysis as a report. So we will definitely include that in that. It's coming out shortly, so we'll definitely include that in our report.
All right, thank you very much, Rish.
So I'll ask the next one. Great research. Thank you for sharing. For the heat-related mortality burden curve, I'd be curious to see heat index and/or dew point along the x-axis. A 90-degree temperature with a 30-degree dew point temperature is different than a 90-degree temperature with a 77-degree dew point. Oh, my bad. There's a never mind on my statement. Thank you. Later on. was looking for the question. Apologies. So the next question is, what is the URL for the heat health tracker? Right now, we cannot obtain fatality information from the state and have to rely on fatalities being reported in the media.
Yeah, I think is that a question, or sorry, Melissa, I didn't understand the last part.
So Rish, I can take that for a quick second. We will share the URLs that Rish had in his presentation when you get the follow-up email from this webinar. And actually, I know the person who asked that, so I can make sure I get it to you directly. Thanks.
Sure, and yeah, I can send you the link for the heat health tracker, and also for the CDC Wonder database if you don't have that already, where you can get mortality information.
Excellent. Sorry, guys. You can hear me. All right. I thought I was on mute. Apologies, everyone. All right. The next question we had. What advice do you have on where to gather heat-related health impacts for entering data into the storms event database? This was from, for example, for Oregon and Washington.
Sorry, yeah, I think one resource would be existing publications, and I know we don't have these heat health impact information published on CDC website, but yeah, but one option is to sort of look at what's already being published, and most of those studies provide information for various locations. And I don't know specifically if that information is available for Oregon or Washington, but hopefully, we should be able to publish the information that I showed today, like fairly quickly.
Great, excellent. I don't think there's any more questions in the question boxes. And I do realize now that those that had questions beside them, their names had asked questions as well. So unless there's anybody else that didn't have a chance to respond or ask their question. All right, I don't think we're seeing any more questions. Kim?
Okay, thank you everyone for your questions. Thank you for attending. Rish, thank you so much for an amazing presentation. Like I stated before, we have recorded this webinar and we will be sending a follow-up email with the link to the webinar, to the recording when it's available. Thanks everyone, take care.
Thank you.